I'm Dr. Tatis Krasian, and I want to talk to you about why subtle bloating and heartburn are actually much, much more serious than many people may think. The simple model of having heartburn and then taking an acid to avoid those symptoms is really a dangerous model and one that completely violates all the principles of preventive medicine. One of the things that we know is that when people have heartburn and have intolerance to digesting proteins, they can't produce enough hydrochloric acid, that the underlying mechanism for that could actually be an Helicobacter pylori or an H. pylori infection. And H. pylori is a bacterial organism that furrows into the lining of the stomach. It suppresses cells in the stomach called parietal cells from releasing hydrochloric acid, and that's the enzyme we use to digest protein. So when people start to get these H. pylori infections in their gut, then they have a very hard time digesting protein. So when people eat, they get really bloated. When they eat a really rich protein meal like eggs or meat or things like that. And they also get really bad breath. And when they have their acidic environment reduced from this infection, this really sets up the stage for all types of gastrointestinal imbalances all the way down the GI tract, because we really need that initial step of acidity to change the pH of the gut and to really neutralize any types of infections that may be ingested when we consume foods. So one of the things that we know is that when people have this pattern of heartburn and intolerance to proteins, that they actually do in fact have H. pylori infections. And when people are given antacids to get rid of the burning symptoms, the neutralization of acids even makes the patient even more prone to have recurring H. pylori infections, because you need that acidic environment to get rid of them. But H. pylori is really a bacteria that has far-reaching effects on multiple systems of the body. H. pylori has been shown to be very destructive to the vascular endothelium. There's over 1,000 papers now published in the scientific literature that shows H. pylori is as dangerous to the blood vessels as hepatitis C virus is to the liver. H. pylori literally goes in to the blood vessels, destroys them, and sets up the stage for atherosclerotic plaquing. And with many cadaver studies where they look at plaquing, they see H. pylori as one of the key antigenic triggers for atherosclerosis and heart disease. H. pylori also, especially in silent forms where there isn't a lot of burning and symptoms, it's just subtle, is also a major risk factor for developing gastric carcinoma. So when someone has heartburn and they are immediately given antacids and not tested for H. pylori, there's this risk for gastric carcinoma that is pretty significant in the next 10 to 20 years. Now, the other thing that we know is that H. pylori can cross-react with thyroid, and H. pylori has been shown to be a trigger for things like Hashimoto's hypothyroidism. So this is a really important concept, and this is one of the things that we'll be going over in the Krasian Institute module, gastrointestinal clinical strategies and treatment applications. We're going to go over the depth what each of these little clinical findings mean and how to really work these patterns up and really how to evaluate for H. pylori and look at all the risk factors and go over all the research. And this is just one example of one clinical symptom, which is just heartburn and bloating. We'll be going over a lot of different clinical presentations and going into how we really implement the highest level of preventive medicine using diet, nutrition, lifestyle, early detection to help patients that are suffering from gastrointestinal disorders. Thank you for your time.